In our interview, Dr. Faisal Shuaib speaks about the Community Health Influencers, Promoters and Services Program. Dr. Faisal Shuaib, you're welcome to the program.
I'm happy to be here on this program.
Well, let's take a look now. The president launched the revitalization program for primary healthcare centers sometime last year. And now again, he's launching the Community Health Influencers, Promoters and Services Program. What is this all about?
The Community Health Influencers, Promoters and Services Program, known as CHIPS for short, is actually a program that deploys women who have been trained to communities, the last mile, in terms of reaching rural communities where people do not have access to healthcare. The launch of the CHIPS program by Mr. President really is a complementary move that addresses demand-side issues, right? So while on the one hand, I think about a year ago, Mr. President launched the revitalization program at Kuchingoro. That has to do with, getting the right infrastructure, the health facility, the health workers, the drugs, the utilities for a functional health system, right? But when you have a health facility that is functional, you also need the community members being engaged, being linked to that health facility. So what the CHIPS agents are doing is actually influencing, changing behavior, promoting positive health attitudes, and linking community members to the health facilities. So they go to the households. If there's a pregnant woman, they advise her to go for antenatal care, because it is well known that for women who have antenatal care, then the deliveries are less likely to be complicated because they end up having their babies at home. And then even for kids who are born, the CHIPS agents will encourage the women on the need for vaccinations and promote the attendance of the health facilities for vaccinations. I know you are well aware that the survey that was done a few years ago, 2015, 2016 to be exact, showed that only some 25% of children in Nigeria are fully vaccinated. Now, these CHIPS agents will promote, create awareness around immunizations, among all the other things they will be doing. So we're addressing the demand side issues along with the supply side issues, so that there is a health facility and then there are people going to those health facilities to access treatment.
Who were the people responsible for this before now?
So before now, we've had a very disjointed, fragmented, poorly coordinated community health sort of interventions, largely driven by donors and development partners. For instance, UNICEF had almost 18,000 volunteer community mobilizers who worked largely on the polio eradication effort. We had the corps as well. We had the village health workers.
Is that still ongoing?
That is all still ongoing. But what we're doing with the launch of the CHIPS is now harmonizing all of these interventions that have high impact and scaling it up.
How?
So in every state, we're engaging with the governors, contextualizing it, and saying, we would recommend that you have between 10 to 20 CHIPS agents per ward. But what does your resources say? Do you have the funding to provide some stipends, some commodities that will ensure that you recruit these women in each ward? So at the end of the day, by the time we recruit between 10 to 20 women CHIPS agents per ward, we'll be approaching nearly 200,000 CHIPS agents. This will be the largest aggregation of community-based workers anywhere in Africa. There's no doubt, the science is clear, that these community-based workers are important. What we have done now is moved away from just the policy of the Federal Ministry of Health or the federal government and actually executing on it. So we've started with a few states like Nasarawa that have started rolling it out, and we're going state by state. You
mentioned 200,000 across where?
Across the whole country. So this is how it works, right? So if you have an average of, say, 10 to 20 CHIPS agents per ward, Nigeria has approximately 10,000 wards, right? So by the time you multiply 20,000 across 10,000 wards, you're getting about 200,000 CHIPS agents across Nigeria. But again, the federal government is not legislating or prescribing that these are the exact numbers of CHIPS agents that you must have in your state. We leave that to the state governors, we leave that to the political leaders, the traditional institution, and say, based on the size of my wards, maybe I need only 10 CHIPS agents, maybe I need 20 because we have a large ward. That is why we're not saying it is exactly 200,000. We say by the time we're done, we should be approaching 200,000. There might be a few wards where people say the population is so dense and we want people to have access to healthcare services. You know, so we want even more than what the federal government is sort of providing guidance around.
Let's talk about funding right now. As ambitious and lofty as this idea sounds, the question of effectiveness, efficiency, of course, would raise a lot of concern. We have seen a lot of bright ideas go, underground because of the issue of funding. How are you going to ensure that this will sail through for a long period, or it's going to be sustainable, basically?
We've sort of addressed this on multiple fronts. At national level, we've gotten alignment, across the Federal Ministry of Health, the National Primary Healthcare Development Agency, and the development partners, agreeing on what the standards should be. We've also engaged with the private sector, like pharmaceutical companies, who see this as a laudable idea. And quite a number of them have already offered that they will provide some of these drugs free for a particular period. So we can expect to have anti-malarials, right? That are going from household to household, treating people. That is ensuring that what we're able to do at national level is sustainable. And the federal government is not saying that we're going to pay for everything. There are roles and responsibilities for the different tiers of government. So at national level, there's that alignment. We'll provide some of the commodities, but we'll also help in providing the guidelines to train and to also monitor that it is only what these CHIPS agents have been trained to do that they will implement in the communities.
So the states have bought into this idea?
We have presented this since last year, actually almost 6 months ago to the date, to the Nigeria Governors Forum. And the governors love it because the governors have it very clear in their vision that they want to get healthcare to every last citizen.
So payment and welfare would not be an issue?
It shouldn't be an issue because we're contextualizing it. Every state takes the CHIPS program and customizes it along the lines of what resources they have.
Very quickly, this will not be hijacked by politicians, probably in the days to come, now that we're closer to election days.
This is a professional cadre of workers. If the community health extension workers, the junior community health extension workers have not been hijacked by politicians, right? It is for the simple fact that this is a health focus. People are going to be professionalized. They are not carrying voters' cards. They are not going to talk about politics when they go to the household. All they are doing is providing an important service that has been non-existent in many, many communities. We're bridging a gap and then linking up health services to the next level. So we don't have a lot of concerns about politicians hijacking this. What we're saying is if politicians are interested in making this constituency project, then great, they can provide funding that would go towards ensuring that these CHIP agents get the stipends, get the commodities that they need for their constituents.
Right. Thank you very much, Dr. Faisal Shuaib, for coming on Dateline Abuja.
Thank you very much.
Thank you.
Yes.
Well, thank you for your mails and tweets as always. Keep sending in your views and comments using the email address and Twitter handle on your screen. Also, be sure to share anything happening within your locality. And don't you forget, you can view the program on youtube.com/channelsweb/videos. Thank you for watching this week. I'm Gloria Omezuke. See you again.